Hello, I'm Elizabeth Fowler, a member of the Comanche Nation with descendancy from the Eastern Band of Cherokee Indians. I'm a career IHS employee and a recipient of IHS healthcare services. I take the responsibilities of my position seriously, and I'm steadfastly committed to the provision of quality healthcare as part of the IHS mission of raising the physical, mental, social, and spiritual health of American Indians and Alaska Natives to the highest level. I'm honored to work with a dedicated, highly skilled, and hardworking IHS team. Every day, we focus on quality and culturally appropriate patient care. Our work requires strong leadership and demands accountability from every IHS employee. An important part of our commitment to promoting this culture of quality is freedom from sexual abuse, harassment, and discrimination. This includes protecting our patient population and our employees. Everyone within the IHS has a shared responsibility to report suspicions of abuse, harassment, or discrimination. Our employees should have the confidence to know that they can report something they see or suspect, and their report will be taken seriously. Leaders across our agency are expected to model behavior that promotes a safe reporting environment without reprisal. One of the ways we've acted on this commitment is to update our policies. We've updated our policies in 2019 to include provider-patient boundaries, medical examination precautions, reporting responsibilities, and protections for patients and staff. In 2019, the OIG found that we'd strengthened our policies for protecting children from sexual abuse, but they noted we should go further to include more types of perpetrators, victims, and abuse. In 2020, the OIG found that IHS facilities had made progress in incorporating these new policies. However, they also identified some remaining challenges in carrying them out. You can learn more about OIG's findings and recommendations in the other videos in this series. Now, let's turn our attention to a brief look at the current standards and guidance in Part 3, Chapter 20 of the Indian Health Manual. You'll find a link to this manual below. Part 3, Chapter 20 of the Indian Health Manual provides the IHS policy on protecting children from sexual abuse by healthcare providers. This policy describes the standards and guidance for protecting against sexual abuse or exploitation of children by healthcare providers. The policy applies to all IHS healthcare providers, including but not limited to employees, volunteers, and contractors. It covers sexual abuse or even the reasonable suspicion of sexual abuse committed at any location by any provider working for the IHS. The policy prohibits sexual activity, sexual communication, or sexual contact with current or former patients under 18 in all circumstances. It requires chaperones to be provided when requested by a patient, parent, or caregiver. It requires IHS facilities to post information on how staff members, patients, parents, and others may report sexually inappropriate behavior. And it prohibits retaliation, which means that no administrative or other adverse action can be taken against staff who act in good faith to report suspicions of sexual abuse by a healthcare provider. This policy clearly describes the responsibilities for key roles in all IHS staff. The policy also describes certain rights for employees, including confidentiality, reprisals prohibited, and the grievance process. These rights are a very important part of our policy. Training is another critical component of the IHS effort to safeguard our patients. All IHS employees, contractors, and volunteers are required to complete annual training on protecting children from sexual abuse by healthcare providers. You'll find a link to this training below. This training reviews our IHS policy, professional standards, and guidance to protect against sexual abuse or exploitation of children by healthcare providers. The training covers what all IHS staff need to know about their critical role in preventing sexual abuse of children. In addition to our focus on prevention, we also highlight the importance of delivering trauma-informed care. Trauma resulting from any form of violence or victimization can have a significant impact on the health and well-being of our patients. We must be mindful to provide culturally competent healthcare services that promote safety, collaboration, trust, and empowerment. Throughout all of our training, we've worked hard to re-emphasize the important responsibility all IHS providers and staff have for reporting suspected cases of child sexual abuse. However, sometimes individuals may still feel reluctant to report, or perhaps they don't know where to go. In the hopes of lessening these barriers, we've taken several important steps. This includes the establishment of 2 dedicated avenues for reporting suspicions of child abuse or sexual abuse within the IHS. We now have a website available through the IHS homepage that's accessible to everyone at any time. The website was established through a collaboration between the OIG and IHS and created specifically for allegations of abuse. You can find a link to this website below the video in the Helpful Resources section. From our website, you can click to access a reporting form. The form will guide you through a set of questions to collect the critical information you'll include in your report. The website is also mobile compatible, so it's possible to make a report directly from your smartphone as well as your computer. If you prefer, you can also call our dedicated hotline for reporting suspected child abuse or sexual abuse within the IHS. The number is 1-855-IHS or 1-855-723-3447. This hotline is staffed from 8 a.m. to 8 p.m. Eastern Time, Monday through Friday, by specially trained professionals. Outside these hours, callers can leave a detailed message with information they'd like to report. Trained staff will provide a return call during normal business hours and generally within 24 hours. Anyone reporting by phone or online may remain anonymous. It's important to remember that reporting child abuse to this hotline does not take the place of making a report to local law enforcement or child protective services as required under federal law. When child abuse is suspected or observed, mandatory reporters must also file a report with the appropriate local law enforcement or child protection agency. All IHS employees are mandatory reporters. You can find more information about this hotline on the IHS website, which is linked below. I also want to highlight 2 other hotlines available to everyone. To report suspected fraud, waste, abuse, or mismanagement within the IHS, please call the IHS hotline at 301-443-0658. Individuals can also call the OIG hotline at 1-800-HHS-TIP or 1-800-447-8477. OIG's hotline is available for reports of fraud, waste, and abuse across HHS programs. In closing, the Indian Health Service's top priority is providing high-quality health care. It's critically important that we protect our patients and our employees. We must all do our part to foster a culture of safety, accountability, and freedom from fear of reprisal. Together, we can raise the physical, mental, social, and spiritual health of American Indians and Alaska Natives to the highest level. Thank you.